All right, let's just get right into it. Welcome to today's Explainer. We are skipping the usual preamble today because we need to jump straight into one of the absolute most terrifying medical mysteries of the human body. We're looking at the silent anatomy of sudden heart attacks.
Picture this, because it's a crazy paradox. A 42-year-old marathon runner. He's got perfect cholesterol, he works out 5 days a week, absolutely no symptoms, zero warning signs. And then, last Tuesday, sudden cardiac arrest. He literally almost died. It's a shocking story, isn't it? Because we've all been conditioned to believe that if you can run a marathon, if you eat right, if you feel fantastic, well, your heart must be an impenetrable fortress. But this incredibly fit athlete nearly losing his life proves something extremely important. Feeling perfectly healthy absolutely does not always equal having a healthy heart.
So the big question is this: why is your body straight up lying to you about your heart health? Because, make no mistake, that is exactly what's happening here. It's a hidden deception. And the statistics behind this are frankly staggering. I really want you to process this for a second. 50% of men and 64% of women who die from sudden cardiac events do so without experiencing a single warning sign beforehand. No chest pain, no shortness of breath, nothing. Today, we're going to uncover the hidden mechanism behind this deadly silence. And more importantly, we'll look at how to actually know if you are safe. But to understand the deception, we first have to understand what your heart actually wants.
Okay, Section 1, the myth of perfect health.
Look, your heart is a muscle, sure, but unlike your biceps, it literally never gets a day off. It is completely obsessed with oxygen, demanding a fresh supply 24/7. And it gets this oxygen through a network of coronary arteries that wrap around it, kind of like the roots of a tree. You've got two main players here, the right coronary artery and the left coronary artery. Now that left one branches into something called the LAD, or left anterior descending artery. In the ER, medical professionals ominously call the LAD the widowmaker. Why? Because it supplies blood to your heart's main pumping chamber. If you block this specific vessel, the entire bottom half of your heart dies instantly. So, now that we know what the stakes are, let's explore how the danger actually hides from us.
Moving on to Section 2, the plaque buildup deception.
You know how most of us picture plaque building up? We think of it like a clogged pipe under the bathroom sink, getting narrower and narrower until one day it just totally stops up. But that's a complete myth. In reality, over decades, things like high blood pressure, high blood sugar, smoking, or even the stress of super intense exercise create tiny microscopic scratches on the inside of your blood vessels. Your body tries to be helpful and heal these scratches by patching them with LDL cholesterol, which immune cells then harden into plaque. But here is the massive deception. As that plaque grows, the artery walls actually stretch outward. In the medical world, this process is called positive remodeling.
And this right here brilliantly illustrates the deadly trick your body is playing on you. Because the artery stretches outward, you can have a massive amount of plaque buildup, but the inside of the tube, where the blood actually flows, stays entirely open. Your blood flow stays at 100% normal. You have absolutely zero symptoms. You can literally go out, run a marathon, feel totally fantastic, and be completely unaware that you are in mortal danger. This trick of positive remodeling is exactly why the very first symptom of heart disease for half of all men is simply sudden death. So, what flips the switch? What turns this silent, stable plaque into a sudden, fatal event?
Which brings us to Section 3, the rupture and the clot.
Okay, when this happens, it happens fast. Imagine that outwardly stretched plaque is basically a blister covered by a very, very thin layer of skin. And inside that blister is just a toxic soup of inflammatory garbage. One day, maybe you have a sudden spike in blood pressure, some extreme stress, or a really intense workout. Step 1 happens. That thin skin tears. The plaque ruptures. Step 2, all that inflammatory garbage spills directly into your bloodstream. Your body immediately hits the panic button. It sees this massive spill as a catastrophic, life-threatening wound. So, Step 3, within just minutes, we're talking absolute biological chaos here, your blood platelets swarm the area and form a massive clot to try and stop it. It is not the slow-growing plaque that blocks the blood, it's this sudden, violent clot that completely seals the artery. Boom, zero blood flow. Heart tissue starts dying immediately. This is what we call a type 1 heart attack. But a sudden rupture isn't the only way a highly fit person can be struck down. Let's look at a second, equally deceptive scenario.
Let's look at Section 4, when demand exceeds supply.
Now, contrast the type 1 attack we just talked about with a type 2 attack. Consider the case of Robert from our source material. Robert is 50. He's a disciplined runner, completely normal cholesterol. During a big race, he doesn't feel crushing chest pain, he just feels weird, lightheaded,
nauseous. He assumes he's just dehydrated, right? But at the hospital, doctors find a protein called troponin in his blood, which is a definitive marker of cell death. He is having a heart attack. Yet when they actually look at his arteries, there is only a 50% blockage. So wait, how is that a heart attack? Well, it's a simple supply and demand problem. Sitting on the couch, a 50% crimped artery is perfectly fine. But during his race, his heart rate hit 170 beats per minute. His heart was basically screaming for a fire hose of oxygen, but his crimped artery could only deliver a garden hose. The demand far exceeded the supply, and his heart literally started suffocating, a condition called ischemia. And this was made even worse because Robert had atrial fibrillation, which is a chaotic heartbeat that further stressed the whole system. It's totally silent cell death.
So here's the real kicker. You actually won't feel chest pain from a blockage until your artery is roughly 70% blocked. At 70%, yeah, you might feel some tightness when climbing a flight of stairs that magically goes away when you sit back down. Doctors call this stable angina. It is essentially your body's check engine light. But here is the cruel, cruel irony. Most heart attacks happen in people with less than a 50% blockage. Why? Because that invisible, outward-growing soft plaque we talked about earlier, it's highly unstable. It pops before it ever reaches that 70% mark. The hard plaque, the kind that slowly clogs the artery over years and years, is actually pretty stable. It gives you that 70% check engine light warning. The soft plaque, it just kills you without any warning at all. Now take a breath, because it's not all doom and gloom. The human body is remarkably resilient. Let's look at how your heart actually fights back.
All right, Section 5, your heart's hidden defenses. And this right here brilliantly illustrates why some people somehow survive seemingly fatal blockages. It's a phenomenon called collateral circulation. Think of your main arteries as major interstate highways. If a massive traffic jam persists on that highway for years, your heart actually begins to build side streets, these tiny, intricate detour vessels completely around the blockage. This is exactly why a 7-year-old might survive a major heart attack that would instantly kill a 40-year-old. The older heart literally had the time to build those escape routes. The younger person, the highway shuts down suddenly and there's just no way around it. The really good news here, you can force these side streets to grow. By using Zone 2 training, steady cardio, and high-intensity interval training, or HIIT, you can trigger this growth. Exercise literally builds the network that buys you time.
But notice how time is the absolute ultimate currency here. At 0 minutes, the flow is blocked. At exactly 20 minutes, irreversible damage begins. And by 90 minutes, that dying heart tissue has turned into permanent scar tissue. And let me tell you, scar tissue does not pump. In the cardiology world, they have a saying, time is muscle. Rapid recognition of an event is absolutely everything.
Which brings us to recognizing the symptoms, because honestly, they differ wildly. For men, it's very often the classic Hollywood heart attack, crushing chest pressure, pain shooting down the left arm, jaw pain. But for women, the symptoms are incredibly insidious. We are talking extreme unexplained fatigue, sudden shortness of breath, and intense acid reflux that just feels like really bad indigestion. Here is the absolute, non-negotiable rule. If you are exercising and you feel a sudden, profound sense of doom or any of these weird symptoms, stop. Do not try to push through it. Call 911 immediately. And whatever you do, do not drive yourself to the hospital. Remember, time is muscle. Okay, let's move to our final section and see how we can actually get ahead of this thing.
Finally, Section 6, how to detect the danger.
Look, if you do have a blockage, cardiologists can fix it. They can do a PCI. They thread a tiny catheter up through your wrist, find the jam with a special dye, inflate a balloon to smash the plaque out of the way, and deploy a little metal stent to hold the artery open forever. It's honestly incredible technology. But obviously, our goal is to find the blockage way before we need a metal balloon deployed inside our heart. But here is the hard truth. Standard routine blood work won't help you do that. Blood work only tells you the ingredients floating around in your blood. It absolutely does not tell you if those ingredients are actively sticking to your artery walls and forming those dangerous blisters. For that, you really need early imaging.
The first essential tool you need to know about is the CAC score. It's a really simple 5-minute scan that looks for hardened calcium in your arteries. And the stakes here are very clear. A score of 0 is perfect, but a score over 400, you are basically a ticking time bomb. It is a super vital baseline to understand your actual risk level.
But to truly see the invisible enemy, that outward stretching soft plaque we've been talking about this whole time, you need a CT angiogram. This is the ultimate early warning system. It actually allows doctors to see those unstable inflammatory blisters before they ever rupture. It literally catches the type 1 heart attack before the blister ever gets a chance to pop.
So let's bring this all together. What actionable steps can you actually take today? Number 1, control your blood pressure. This literally stops the physical, mechanical tearing and scratching of the inside of your arteries. Number 2, manage your blood sugar to prevent the underlying inflammation that fills those plaque blisters with toxic garbage. Number 3, exercise consistently to build up that collateral circulation, those life-saving side streets we talked about. And number 4, get screened. Don't just guess that you're healthy simply because you can go out and run a 5K. Use the incredible technology we have, the CAC and CT angiograms, to know what your actual risk is.
Having a healthy heart attack is almost always just a tragedy of ignorance. We simply don't know what's happening beneath the surface. So please don't be in the dark about your own heart. I want to leave you with this question to really think about. And please drop your thoughts down in the comments. What surprised you the most today about how heart attacks actually happen? Was it the weird outward stretching of the arteries? Or maybe the crazy difference between a type 1 sudden clot and a type 2 suffocation? Think on it, take some action for your own health, and we will see you in the next